All right, we've still got a couple people joining, but we'll go ahead and get started so we can try to get it done on time. My name is Gage Redemarker. I am a staff senator for the Professional Development Committee. This presentation is a part of our Lunch and Learn series. So this is a recurring series. We're going to be doing this on the third Friday of each month. It is just a little time for us to talk about some things and try to learn something new. We have our October scheduled. I'll speak about that at the end, but we are still looking for presenters, ideas, other suggestions. So if you have anything that you would like to hear about, or if you want to do it, I will be putting some contact info in the chat. We definitely would like for you guys to ask questions as they come up. Feel free to unmute if it's appropriate. You can use the raise hand feature in Zoom, and that'll pop you up to the front so we can see. And also, if you put anything in chat, we will get to that. Up first, we have a presenter, Melissa Claar. She's from Retain, Kentucky. She's been with UK for a while, done a lot of things. So hopefully she's a familiar face to some of you. And Melissa, you can go ahead and get started.
Thank you, Gage. All right, so as Gage said, excuse me, I've been at UK for the last 11 years. I spent 3 years at occupational health, University. It's sports physical therapy. Sorry about that. And then I spent 8 years on campus at occupational health and safety. And most of you may know me more so from ergonomic assessments. But after hearing and seeing about Retain's work, I was excited when an opportunity presented for me to join the team. And I can't wait to share with you the work that we are doing at Retain and across Kentucky. So my objectives for this presentation, I'm going to describe Retain services. I'm going to identify Retain eligibility criteria, and then I'm going to list the steps for referrals to Retain. So every year, millions of Americans are leaving the workforce due to an injury or illness. Employees are leaving jobs. They face health challenges, financial problems, the loss of health benefits, and a poor quality of life. Employers are facing unexpected expenses due to the loss of valuable employees, and governments at all levels are facing reductions in tax base, costly payouts of disability benefits, and decreased economic activity. The whole process of getting people back to work is complex, not only for the employer, but the worker and the healthcare provider. So the Retain initiative, Retain actually stands for Retaining Employment and Talent After Injury Illness Network. It is a U.S. Department of Labor research study that's focused on helping individuals across the Commonwealth stay in the workforce after an injury or illness that's happened outside of work. Retain is promoting those stay at work and return to work policies through direct intervention research to 3,200 participants statewide. We're building capacity of future professionals who are going to be working across disciplines and influencing employment for all people in Kentucky. And we're looking at a multi-systems change through the development of an inclusive worker health leadership network with employer and healthcare driven leadership. We believe that those who are closest to the work know the work best. Medical professionals, public health leaders, employers, and workforce development, along with the Kentucky Chamber of Commerce, we're working collaboratively to help connect healthcare and workforce systems that offer input around best practices that promote the ability of Kentuckians to stay in the workforce. Keeping workers connected to employment isn't just a workforce issue, and it isn't just a healthcare issue. It's both, and it requires a multi-systems change to be successful. Ultimately, we intend to embed stay at work and return to work interventions and strategies across systems that will long continue after our grant ends. Kentucky has a story, and we need assistance telling it. We need your help with capturing the data and identifying gaps to create resources for Kentuckians. This goes back to serving the 3,200 individuals statewide. So Retain actually started as a pilot program with goals to increase employment retention, increase labor force participation, to reduce long-term work disability, and to validate and bring to scale evidence-based strategies that accomplish these goals. In phase 1, services were provided in 7 counties around Louisville and 7 counties around Lexington. We were able to serve over 200 Kentucky workers and train more than 1,000 professionals. In April 2021, Kentucky was one of 5 states that was awarded funding for phase 2. The other states included Ohio, Kansas, Minnesota, and Vermont. All I have to say about that is go Cats. So in phase 2, as I mentioned in the previous slide, Retain has expanded to provide early and intensive intervention and direct services coordinated through to those 3,200 Kentuckians who are at risk of leaving the workforce due to their injury or illness. Research shows that people with non-occupational injury or illnesses are at a high risk of becoming unemployed, and we want to examine how early, intense, and return to work coordination impacts recovery and the likelihood of remaining employed. The federal funding also allows us to address the enduring implications of COVID-19 on the physical and mental health of Kentucky's workforce. So who is eligible for retained services? So enrollment for phase 2 actually started in October of 2021 and will continue this through March of 2024. The criteria is very simple. Eligible participants must be 18 years old or older and live in the state of Kentucky. In the past 3 years, they cannot have applied for or are currently receiving SSI, SSDI benefits. They must be currently employed or have been employed in the last 12 months. And they have a non-work related injury or illness that could prevent them from performing their jobs. The diagnosis can be physical, and we don't limit that to anything. It could be cardiovascular, it could be could be musculoskeletal, could be migraines, could be MS, it could be mental. That includes anxiety and depression, could be COVID related, long COVID, and it could be substance use disorder. So I want to emphasize again that our program addresses stay at work. So if you're currently working but struggling, Retain can help. Retained services can be extended to a family member who is injured or ill, allowing employees to focus on staying at work. And given the challenges employers in Kentucky are facing with recruitment and retention of valuable workers, Retain can be an invaluable service. So what's the referral process? There are several ways that you can access retained services. On the left of the screen, you can see our handy dandy QR code. This can be used as a self-referral. By scanning this with your smartphone, it will ask you the eligibility questions that I just mentioned, and then you will submit that. It will redirect you to a screen where you will put your name, phone number, and an email so their awesome intake coordinators can reach out to you. Also at the top of the screen, you can see there's a drop-down menu for different languages. It can be viewed in English, Spanish, Arabic, and Swahili. If you are at UK Healthcare, we have a referral in Epic for patients, but please note this is in the ambulatory section. And then you can just search Retain under the Place Ambulatory Order search bar, if you will. You can also call 859-562-3251 and leave your name and phone number. And again, our awesome intake coordinators will call you back. You can email your name and other contact information to retain@uky.edu. And for more information, you can also visit our website, www.kyretain.org. Feel free to share this with anyone you know that could benefit from retained services. And I'll leave my email at the end of the presentation and you can contact me directly. So how does it work? So all of our enrolled participants have support of a return to work coordinator. Our return to work coordinators are focused on engaging participants, so there's a clear path to return to work. But most importantly, we're putting the participant in the lead role. We're able to quickly engage participants in the process to reduce unnecessary delay in receiving resources. There's no red tape. As soon as intake is complete, they can start. So our return to work coordinators have a training in a variety of specialties, including rehabilitation counseling, social work, occupational therapy, and they have experience in coordinating transitional work placements, career exploration, job development, and job placement to support the stay at work and return to work goals of our participants. I've witnessed firsthand on case staffings of how much our return to work coordinators care and how much they go above and beyond for our participants. And I'm very proud to work with them and alongside of them. Our healthcare champions at PM&R are Dr. Sarah Salas and the Director of Population Health, Jessica Sass. They are there to help support in and around UK healthcare as well. While supporting our participants, our return to work coordinators often find that social determinants of health barriers are some of the reasons why workers aren't able to come to work even after their medical illness issues have resolved. The social determinants of health impact their ability to not only work, but to be successful in the workplace. And the social determinants of health, according to the US Department of Health and Human Services, are conditions in the environment where people are born, they live, they learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Our return to work coordinators and our community partners have connected participants to resources such as food, rent, utilities, childcare, and transportation. Mental health services are also areas our coordinators are able to assist and support our participants. So our research design and interventions, it is a two-group design that participants are randomly assigned to an intervention that is either expedited or enhanced. In the expedited intervention, it is an expedited model of care through self-advocacy that includes a comprehensive intake followed by an assignment to a return to work coordinator. The participant and the return to work coordinator develop a written return to work plan, and based on that participant's specific needs that may include connections to employment and community services. The enhanced intervention includes an intake assignment to a return to work coordinator, the development of a written return to work plan based on the participant's specific needs, as well as weekly support. They may include career counseling, healthcare provider and employer communications, as well as ongoing support and recommendations. An example of this may be providing a job analysis information between the employer and the healthcare provider to make informed decisions for the stay at work and return to work. So what does the written return to work plan look like? So the components of the plan I have here in each of these boxes, and I will give you an example of each of those. So what would be a return to work goal? And I'm going to pretend this is one for myself. So I plan to return to ABC Company as a specialist in HR. So what are my return to work strengths? I've worked for 5 years with ABC Company. I have reliable transportation. I have a valid Kentucky driver's license. I communicate with my ABC Company regularly regarding my return to work status. So what support needs that I may need? So I was diagnosed with COVID with lasting brain fog. This has impacted my memory. I get tired easily when I'm walking. I'm behind on my utilities, and I need assistance with paying for medications. So what are the solutions to my support needs? So it would be something like a referral to the Office of Vocational Rehab for ongoing vocational support. We can get a referral to the CATS network for assistive technology that'll assist with my memory. I apply for Kentucky Disability Parking Placard, the assistance for utility with community resources. So the return to work coordinator will have an action plan, and that will look something like the return to work coordinator will provide me with OVR contact. They'll provide me with HDI CATS contact for a self-referral. We'll have an email application for the parking placard. We can send information for assistance regarding my utilities for LG&E, and then information on resources for my medications. So the participant actions would look something like, I'm going to get my job description with ABC Company to look at job demands. It would be me contacting OVR for a self-referral and HDI CATS for my assisted technology. I may submit the parking application for the placard. We're going to submit assistance forms to LG&E for my utilities, and then still looking at getting assistance with medications. In the additional notes, we're going to actually look at outcomes and any completed steps. So that would be something like the return to work coordinator showed me how to search for good RX prescriptions for my medications. I was able to use that and lower the cost of my medication. I went to Kroger and I reduced my prescription price from $112 to $16. So just to kind of give you an example of what that looks like. So with accommodations, so we know that it's essential that healthcare providers know their patients' essential job functions and demands of those functions for stay at work and return to work decisions. Temporary mental and or physical capacities may prevent patients from returning to their regular job after their injury or illness. This is where our senior job analyst position can be beneficial. This position will provide a listing of job demands in relation to each essential function and how often it is encountered when completing job tasks. Cognitive and psychosocial demands will be added to the evaluations to make them more inclusive. This report will provide essential job functions and demands so that the healthcare provider can make safe stay at work and return to work decisions for their patients. The job analyst can also assist in identifying any opportunities for transitional work, job accommodations, or job modification solutions at the employer, because we want to focus on what they can do rather than what they can't do. So our work is about helping Kentuckians stay connected to the workforce. We provide person-centered interventions in a return to work plan that quickly engages that participant and helps them identify their stay at work and return to work goals. Again, our services start immediately after the intake is completed. And depending upon the intervention, participants are connected to peer supports, assistive technology, social determinant support with community partnerships to address their stay at work, return to work barriers. We are enhancing and expanding healthcare trainings and employer trainings around best practices and stay at work and return to work. And we believe Retain is one component of the state's overall commitment to a healthy and productive workforce and not a siloed grant project. So this is our Retain summary. It briefly describes Retain and the services with the eligibility criteria and ways to enroll in Retain. It also includes our social media information at the bottom, along with my email, if you need to reach out. But again, I want to emphasize that enrollment will go through March of 2024. We have materials translated in English, Spanish, French, Arabic, and Swahili. And we also have access to language interpreters if needed. So when I mentioned our presence on social media on the last slide, we have a YouTube channel. So please visit, like, and subscribe to our Retain Kentucky Media channel. Our channel, we have a monthly employment seminar series on various topics to support stay at work and return to work efforts. Please join us on September 27th at noon to hear our subject matter expert, Kimberly Wickert, as she discussed tools Retain has to help employers in recruitment, retention, and promoting an inclusive workforce. But don't worry, if you can't join us, all recordings of our employment seminar series can be viewed and found on our Retain Kentucky YouTube channel. So as I said at the beginning of the presentation, Kentucky has a story and we need your help telling it. Ways that you can help is by identifying individuals who are eligible for Retain services and sharing information with them. Commit to a training for your team or department. My email is on the screen and I'm here to serve you. Help us build a shared knowledge base to support UK and UK Healthcare's vision of building a healthier Kentucky by participating in Retain. I want to thank you all so very much for your time and the opportunity to share all the great work that is being done in the Commonwealth in helping Kentuckians stay at work and return to work.
Awesome. Thank you, Melissa. We did have one question in the chat that just popped up.
Okay.
Anne wants to know if someone needs a specific diagnosis or can one have an unknown diagnosis of brain-like fog?
So they typically say any ICD-10 code, and that's kind of what but some people that are outside of healthcare may not understand that. So we just say physical, mental, COVID, or substance use disorder. But yes, it can be brain fog. Thank you for that question. And Gage is going to put in the link a survey to Qualtrics that just gives us a little bit of more information about our audience. So if you don't care to fill that out, and then we can know kind of how to tailor, and if there's anything else you would like to hear about Retain or meet up with us.
Hey, Melissa, it's Stephen.
Yes.
Just for clarification, does somebody have to have like a diagnosis? Do they have to see a healthcare professional and be diagnosed with something? Or can they just say, you know, I'm having problems, you know, I've high anxiety and, you know, I've had COVID, I don't feel the same since.
Mhm.
Would that work, or do they have to see a healthcare professional and be diagnosed with something before they could start the process?
So everything is self-reported. So we're not specifically asking for proof of your diagnosis. However, dependent on the intervention, we would like to work with your provider and your employer if you are currently at work. But again, we're not going to speak to anyone unless we have a release of information from you. So it is self-reported.
Thank you.
Thanks, Stephen.
Awesome. Does anyone else have any questions for Melissa? All right, I have linked all of her contact info, her personal email, kentuckyretain.org, their email to get you in touch with their intake coordinators. And as well, there's a little survey to collect demographic info about this presentation. So it would really help Melissa out if you could fill that out. It would be quick. Thank you so much for your time, Melissa.
Thank you. Thank you all for your time and what you do every day.
Awesome. And so this is a two-part series with Melissa's presentation. Today, we also have Daniel Naas. He is employed here at UK in the library's IT. He's also a fellow senator, and he was going to walk us through some pretty interesting data management stuff. So Daniel, it's all yours.
Oh yeah, thank you. I feel like it's going to be a tough act to follow. That's very real, serious healthcare and employment topics, and I'm just going to kind of blunder around online here for a little bit. I hope everybody can hear me okay. I've had a stubborn cough these last couple of days, but I'm trying to power through it. I learned back in '97 that the show must go on, and the stakes have never been higher than they were in that high school production of Bye Bye Birdie. So here we are. And but if I start talking too fast and I get fuzzy, just say something in the chat. And but anyway, cool. So yeah, and I was very flattered by the description that went out in the email. It made it sound like I really ought to get into like workflow optimization consulting or something. But really, I'm just a tech guy in the libraries who likes tinkering with stuff. And let me bring my slides up here. I have a few startup slides. Let me share my screen. I probably should have picked a smaller metaphor than a galaxy for a 30-minute presentation, but sometimes I get excited and dream big, and here we are, finding constellations in your galaxy of data. I mean, everybody, I've been with the university about 15 years now, and I just have oodles and oodles of spreadsheets and Word documents and Adobe Acrobat things and data here and data there, things. Just to give a bit of context here to start out, like I said, I've been with the university since about 2002. Come on, go ahead. There we go. I started out as a couple of years as a library student assistant at the Little Fine Arts Library and moved into full-time staff there doing audiovisual support and taking care of the media center. And then a couple of years ago, moved over to Young Library to get into our little IT department where I kind of look after the library catalog and the proxy server and various things that they talk to. But I kind of want to set the stage here where like I'm always thinking about, like in libraries, we're always kind of thinking about how data is arranged, how it moves around, like whether it's big stuff like the millions of records that are going in and out of the catalog every day, or if it's just like little stuff like just making the little fields on a PDF form where you can actually type into it instead of having to do where you move the spaces around and you have to backspace to get rid of the underlines, like that kind of stuff. And it reminds me of when I was first starting out here at the university. They were saying I was a student assistant. And so this was like 2006 or something. And so say 2,000 records, whatever, maybe it's people's personal records or something. Maybe we change the way we're doing the addresses or something. We need to update all these records, print out all these checklists. We're going to hand it to the student staff. So I'm on the student staff. So of course, then we spend one summer manually going through the system, changing, or going through and have one screen going here, one screen going here, just transcribing, repetitive. You know, just thinking there has to be a better way. And back in the day, software was kind of like that, where you had one thing storing data in triangle-shaped boxes. You had one thing storing data in circle-shaped boxes. Like nothing got along really well. It's just a headache trying to move that stuff from one thing to another. Like if Office was kind of good about talking to itself a little bit, but if you needed to say move from FileMaker into Word, I don't know. But anyway, the specifics aren't important. If maybe y'all were doing this around 2004, 5, 6, like I was, you maybe remember it used to be a pain to move stuff around. And things kind of started getting better. Like if you had a professional programmer on your staff who could actually kind of dig into the guts of some of the software a little bit, you could come up with some custom solutions to pluck data out of one system and kind of work on it a little bit and feed it into something else. Still, it was, there's a lot of custom work involved, and solutions were finicky and troublesome, and it's just a ton of work involved, and so it just wasn't very accessible to most folks who are doing day-to-day work, all this stuff that's coming in. And then things kind of got a little better. Like APIs really started taking off. I don't know, 7, 8 years ago. I'm messing up my timelines probably a little bit here. And what you kind of start seeing is more standardization, where a lot of these major software things would then kind of have like a side door where the data was a little more predictable and it was kind of structured in a way that other systems kind of knew how to understand. So you could take a bucket full of data from Google Forms and go dump it into Word or something like that without having to do a lot of extra work. But it wasn't terribly accessible because you still might have to have some custom programming. You might have to have some script written in Python or something that would take care of the transfer between the two systems. Well, we have access to this tool in our Office 365 subscription called Power Automate that kind of adds an extra layer onto this that takes care of a lot of this movement and conversion for you and slaps kind of a nice graphical interface on top of it and really strives to, as they say, provide a low-code interface to help you build connections between these things that you're already using. Like I'm guessing right now, any of y'all who are in a department that maybe has more than 3 people, you probably have some people who prefer to use Excel and some people who prefer to use Google Sheets, or some folks that use Google Drive, some folks use OneDrive, some folks that use Box, some folks that use Dropbox, some folks that use Google Forms, some folks that use SurveyMonkey, some folks that use Jotform. Like it just goes on and on and on. Like there are so many different online cloud-based services, all sorts of different things, project management, survey collection, spreadsheets. And a lot of times it almost just seems like whichever one you got exposed to first is then the one you kind of stick with. And so it's just all over the place. And of course, even if folks are kind of doing the same work in the same office, they might be doing it slightly different ways. They might be moving things around. They might be storing stuff differently. Maybe some folks put stuff on SharePoint and some folks don't. And so really, this is kind of like, I'm kind of shooting in this next bit to kind of go over some of like a high kind of theoretical, conceptual kind of thing where you kind of look around at what you're currently doing. Like I'm not looking to come into this presentation and tell you, no, throw everything out you're doing now. Like we kind of have a tool here where you can kind of think about where you have things stored and what you're touching on an average day, and maybe find a case where, say, if you prefer to store stuff in, like if you are working in Google Drive a lot, but really stuff maybe needs to go on SharePoint once a month to back it up, then you can build a little thing that will take care of that for you. Or maybe you have some kind of web forum that maybe defaults goes to one person and you want to have multiple people be able to get to it, or maybe some kind of note when something changes. Like this, I feel like this is a good tool to kind of build off things you're already doing and try and smooth out the connections a little bit That way maybe files aren't going missing or data isn't getting lost or things aren't getting accidentally deleted. And so we're just kind of go into like a hypothetical exercise here. Let me make sure I'm doing it right on time. Oh yeah, I am. Just to kind of show how one would build one of these processes in a hypothetical kind of pizza party example, which doesn't really probably apply to anybody specifically, but just to kind of show in action, collecting data, storing data, getting notifications, that sort of thing. And I'd said in the description that I'm going to have some takeaway exercises. I need a couple more days to polish them up a little bit. So we'll send a follow-up after this meeting where I'll give you a couple of step-by-step things you can then try out various things in the system. So hopefully my voice will hold out here. I think that's my last slide. And now we're going to dig into the actual action. So just start at Microsoft Office, and it's kind of tucked away here. This is just office.com. This is just the the web version of our Office 365 or Microsoft Office software, and kind of tucked away in the little shoot, I forget myself, up here in the 3x3 grid. Got this guy here, and I'm just going to switch over. And the first time you do it, I think there's an additional activation step. You'll just go through it, and it'll point you here on the landing page. And then here you'll see this is where we just were looking at in the slide there, where it goes on and gives you a couple of suggestions of popular things. And oh, I did have one more slide. I was going to say that you might have noticed when I just clicked over that interface real quick, some familiar icons. Like there are a bunch of things already loaded into this system. Like this system already talks to a lot of common things. Microsoft products, big Google products, tons of other stuff. You see Dropbox, Trello, Adobe Acrobat there. That's not one I've touched much, but if you're involved in any workflows that have Adobe document signing, this might be of interest to you. Or uploading files to YouTube, that sort of thing. So let me hop back over to my web exercise here. And I'll just do a brief dip into templates here, just to kind of give another look at a lot of just tons of suggestions and familiar icons. Like I encourage everyone just, if you have a little free time here on this Friday afternoon, maybe just get in here later and just browse a bit and see, like there are a bunch of suggestions on here. Get an email when some tweet keyword occurs, like get an RSS feed thing, get all kinds of notifications. Just get in here and think about things that you use, and just chuck it in there and see maybe what suggestions it has for you. Now there's some stuff you'll see, some of them are marked premium and we don't have access to those, but there's a lot of standard stuff in here that's just ready to go right off the bat. And if there's a canned one that works for you, then you'll click on it and it'll ask you to, like if it's something that needs your sign in, it'll ask you to authenticate. And then it might ask you for some specifics related to your circumstances. Like if it's something that's going to send you an email message, it may want to know like your email, or if it wants to monitor a Google spreadsheet, it'll want like the address of the spreadsheet or something like that. So it may ask for a little additional information specific to your needs. It's pretty much ready to go. But say maybe there's not a great fit in the template, then here's where we can actually go in and start fiddling around with making one from scratch, which I find kind of fun. Just to get into the example I was kind of hinted at a little bit, I'm just going to kind of go into create here. And there are a couple of different kind of flows. The three that I'm really interested in today are these automated ones that react when something happens. Somebody posts a tweet, somebody submits a form, somebody uploads a file to SharePoint. Like the system watches for triggers that you define ahead of time. This instant one is something that you can actually get in and trigger with your phone, with your Teams client, stuff like that, that you decide when it happens. And then there's a scheduled one, say you wanted to back up files from Google Drive to SharePoint once a month. That's when you'd get in and kind of queue up the scheduled one that would then do its thing. Periodically check a website for updates, send out an email message to your team, stuff like that. But we're going to do an automated one here in this demonstration. And I made a Microsoft form ahead of time that I'm going to be referring to. And I made an Excel spreadsheet ahead of time too. But what I'm curious about is when a new form is submitted, like say I'm putting together a party and I send out an email with a form link to all my students in my department, and I want them to pick toppings and side dish. I have my form that I made ahead of time. And I'm going to add a new step now. What do I want to do when the form comes in? Well, in this case, I want to get the details. Yeah, get response details. Like all these, like both Google and Microsoft Forms feed their own spreadsheet by default. But kind of what I want to do, like I want to put all the same, like I'm going to do a couple of these events over the year, and I want to have it feed into the same workbook every time, just with different tabs. That way, at the end of the semester, I have it all there with me. I can see all my attendance, all the stuff, all right there. And so I'm kind of skipping past the default sheet that the form goes to, and I'm going to tell it to get the details. And I'm telling it which it's just asking me to make sure that I'm using the specific form that comes in. And then I want it to feed into my Excel sheet that I made ahead of time. Update a row. And then this is where I'm browsing to the sheet in my OneDrive. Like you're going to see a lot of extra clutter in these menus because I have tons of folders that have been here forever. And I'm going to open the file. And you might see as I'm browsing around, like it pops up a lot of contextual menus. It asks you, do you want to do this? Do you want to do that? Like it tries to guess what you're getting at to save you some trouble. Take the table here. I want to get the toppings data. And, oh wait, that's not right, hang on. Let me, yeah. And then I'm going to feed it the key column. Wait, hang on, I think I skipped a step here. Let me grab my sample one real quick. See what I did. Now how it goes. How many times you practice this stuff as soon as you go live. Oh, whoops, I see what I did. I hit update a row instead of add a row, and so that's why I was asking me what row I wanted to update. So let me back up a step. But then I guess I also just demonstrated how when I realized I made an error, I canceled it out, got to keep my other steps, and now I'm just putting in a new one. So add a row. And let me pull it up again. I'm adding a, go to the file box here. Yeah, that's more like it. And then it asks me what data from the form I want to put in the toppings column. I want to grab, see there's a little forms icon. So I want to grab the form response to the selected topping category and feed it into the toppings column in the table, and then grab the response to the selected side form and feed it into the side dish column. So good. But now I also want to know, like, I want to know anytime anybody fills in survey. And this software is great about, it also is great about generating notifications for any sort of thing. Like if you want to know if something has happened to anything that you work with, and you can set up custom notifications here. And by now, it seems like a lot of folks use Teams on campus. Teams seems like it's taken off really well. And if you haven't used it, I encourage you to check out some of the instructional material that UK IT is putting out. Like they're making a lot of great introductory material to get folks oriented to Teams. But anyway, Teams is great about receiving notifications from other software. So what I want to do is have Teams send me a message. And I want to send it like the Flow bot is kind of like a little dude that kind of interfaces between Power Automate and Teams. And so I'm going to tell it to, he's going to hit my personal channel with him. And I'll just say, new response. And then I can go on and have it tell me, like if I just wanted a brief summary of what the new data was, I will save that. Now say for whatever reason, I also want to get an email when I get a new form, I can go in here and add a parallel branch. Like you can add, you can have an action do multiple things if you want. And I'm just going to go get my Outlook here. And I want to send an email. And I'm just going to send it to me, but say if you were working as a group or something and you wanted to make sure everybody got notified. Or like say you had multiple people who need to monitor a SharePoint folder or something like that. Here's when the new response, here's where you can plug it in. You'll see there's a template where you can make what you want the message to say. Set the template and include these variables from the spreadsheet in it. Let me go on and save that. And so just kind of looking back over it real quick, you'll see, and I really like how they have the little icons on here too, where you can see where when I get in forms, a new response was submitted, it grabs the details from forms, gets into Excel, feeds the forms data into Excel, and then takes the data, chucks it into Teams, and chucks it into Outlook. And so let me, now that I've saved it, let me pull up that form real quick. And y'all should be able to see it happen live here. So I want pepperoni and I want a salad. And let's see if it pops up in the little, let's see if the Zoom recording will pick up the little icon when Teams realizes what's happened. I'm watching for the little purple box pop up.
Daniel, are you set to do not disturb on your Teams?
Yep. And so you're right. And let me hop over and look at it. Go find my chat then. Make sure it worked. Oh, it says it's still running. Okay, so that's what happened. Like it's good about where like you'll see now I've switched over to kind of the little management interface for the thing I just set up, and it's telling me it's still running. So I wonder what it got hung up on. It seems like it's taken a minute. So you'll see as even with little flows like I just made, where it does 2 or 3 things, you can go in and see if it's having trouble. You can see where it's getting hung up. It's just getting crabby about that Excel step for some reason. Huh. I probably still have it open in another tab. But then if it ends up failing, it'll tell you too why, so you can go in and diagnose what happened. It's good about letting you know.
Yeah, so if you have that spreadsheet open, it won't let you save it and then it can't proceed to the next step, right?
Yeah, I think that might be what happened. Let me check my other tabs. Well, no. Okay, well, just a live presentation hitches, of course. Because when I was doing this last night, it just took it about 10 seconds. So anyway, what you'll see, and I'll just hop over to my Teams so you can see where some of the tests were, is that if I can get it to not show my whole Teams window here. Well, shoot. Well, since we're on recording and live here, I can't show my whole Teams window, but I was expecting the little purple pop-up to get down here at the bottom right and say, oh, it just showed the message. Go check on that in a few minutes then. But let me go back and say,
Hey, Daniel, sorry, if you have that chat window open from the bot, you can click on pop out chat so that it will open up just the chat from that bot and drag it onto your presentation.
Thank you. Yeah, I don't have anything especially Scanos in my Teams, but just best practice. But you'll see here where, like right here, it sent me a little message, new feedback, pepperoni and wings. And then also, we'll also send like a email message here. Yeah, like here's a simpler version of the email message. Yeah, folks are asking where it automatically sends it to me. And aside from having it let you know kind of passively when things are going on, there's also, like I was showing earlier, you can have a manual flow. And just to give an example of that, say throughout the, every morning you want to know how many surveys have come in, or you want to see how the data is doing. Well, I had also set up my spreadsheet where it would keep account of the different replies that were coming in. So let me pull that up real quick. That way, like I made a table in the spreadsheet that also keeps account of what's going on in that first spreadsheet. And I mention it because then it let me set up this other flow where I can set a command that when I manually trigger flow, I can get that specific row in the table and then post a message back to, there it is. I don't know if it just popped up in the bottom right there, that purple new feedback, pepperoni and salad. I'm not sure if Zoom will pick that up, but if it did, there it was. So, of course. But anyway, and I can set this up where then I can, if I get curious about it, I can then ask my teams what's going on. And this could be for anything. Say if you wanted to monitor any sort of data thing you had set up. So let me go in and tell it I want to, and I know from working on this ahead of time that it's the second flow that I have set up. And then there we go. And it's thinking. And now I have 4 pepperoni results in my survey. It knows that the data was updated and it sent back, it sent me back the updated count. So like these are all kind of maybe weird and fuzzy examples, but the idea, I mean, I know we're all doing so many different things around campus. The point is just kind of to give a demonstration of ways you can interact with the system and have it interact with other things. And let me see. Run out of words here. Let me get my notes real quick, see what else I was going to look at. And there was another one that I was still debugging, so I won't quite get into it here live. But you could also, like, it can be kind of, it can do kind of context-aware monitoring. Like, say, you know how there are tons of undergrads on campus. Say you really need, maybe only had the budget for like 200 servings of food, and you really need to keep an eye on how the survey was going. You could also add in, say, another branch here and add a condition where, say, you needed to, you want to know maybe once you have about 150 responses coming in, you want to go on and have somebody like the system tell you. That way, maybe you can start winding down promotion or ask for more money or something like that. So you could have it monitor the spreadsheet or for the, like the count of results, and then do something based on that. Maybe close the survey, something like that. So, like, just kind of as you're going through next couple of days, weeks, whatever, like try and think of how processes can be broken down into like predictable bits, like things that you could like if then logic, do this, do that, things that you could communicate easily into the computer. like move this when something occurs, do this other thing, and then just kind of sketch that out, and then come looking in here for opportunities to find connections between those things and see if you can save a little bit of trouble for yourself. And like that example I gave where I triggered something manually for Teams, like I've also found it's handy when and I got to be real careful with this because nobody should be required to use their personal device for any work. That's my official stance. But if you want to have Teams on your phone or something, or even the Power Automate app, then it will let you trigger all your little flows. It'll probably look really weird when I'm doing this on the computer here, holding up the phone. But where's my Zoom screen so I can see how this looks? I've lost the little video screen. Yeah, there we go. Like it probably looks a little wonky, but you see there's a flow app that lets you trigger all your flows made. Again, I don't want anybody to feel pressured to do that with a personal device. It's just an extra thing. If you like feeling like with this stuff like I do, I want to try different things because we actually have, I found it useful to, one of the systems that I oversee, whenever it goes down, the company sends out a very predictable email message that I can then just have a filter where I watch for that message and then get a push notification on my phone. That way I know one of my main systems is down. Then if I want to, I can have like a one-click button that then emails my whole library system to let them know, hey, my system's down. Just little opportunities like that where I found something that, okay, I have a predictable set of steps here and I can combine them into one action that then I just set into motion. So I think I'm getting winded here. So as we approach the hour, I will I just saw the comment about a text or call. Like I think the system, because I think that's an option, but I don't think we support that. Like I looked at it a little bit, and there's a premium SNS option, which yeah, there's something which may require like some. I don't want to say that premium options are unavailable. I just don't have the authority to really comment on them because they might need extra purchasing from your department or from UKIT or something like that. So I don't think SMS is a native feature to this, sadly. But, it could potentially be. And then this system also, I should have you minutes. I almost forgot that aside from the things that are in here, like if anybody wants to get frisky with it and have it connect to other systems, like you can build custom connectors. And you can also, like, it's a smart enough system. Like we did something last year where I wanted to collect feedback from the library catalog. And so I had the library catalog send like a post notification, like it will accept incoming HTTP data. Like it can, that's a little more, like my idea for this presentation was more the accessible stuff that anybody can do day to day. But if you want to get a little more risky with API calls and stuff like that, then it will let you talk to other systems that aren't built into it. But anyway, I just saw another question come in. Had experience with Power Apps. I took the Power Apps when we got that Microsoft skills training. I took the Power App stuff and I dug into it a little bit, and I liked it. It just I don't know. I really liked like it seemed like if I was really looking to do some big workflow overhauling, then I think there's some interesting things. Like, well, it's something I'd like to dig into more. I guess I've used it a little bit, and it seems like it plays really well with Power Apps. I don't have a lot of direct experience with it right now, but like all this stuff, I encourage everybody to go tinker with it, and it's just a lot of interesting things to learn in here. But I'll go on and step back a bit. I'm getting into rambling territory now, so I'll hold back if anybody has any questions or needs me to other questions to elaborate on anything.
Daniel, are there any like a My UK learning? Does that include Power Automate that you can take at your own time?
I'm not sure actually. It wouldn't surprise me if it was in there. If we still have access to that skills stuff, the Microsoft is learning. I believe that there's some in there. Microsoft Skill Essentials, I'm blanking on it. It's stuff that IT was promoting a couple months ago.
Sure.
And then there's a fair bit of good Microsoft documentation too, and then YouTube videos as well. And then a lot of this stuff too, like there's some good read-only exercises you can do in here if you just want to get in. And I'll send a couple of simple one-to-one kind of things too, like maybe subscribe to an RSS for your teams or something like that. Like I have a couple of good bite-sized examples just if folks want to get in and get a good feel for the interface. I'll poke everybody last week. Oh yeah, that reminds me. When I was talking about one-click flow ideas, I think I actually did. Where did it go? I made a flow. That note test one isn't showing up on my mobile. There it is. I was going to dazzle y'all and hit one button on my phone and send everybody a thank you message for attending today. We'll see if it actually works. Yeah, apologies for the spam.
That's all right. Hopefully we get it. Are there almost time to wrap up? Do we have any other questions in the chat or to unmute and ask Daniel?
And I'll say real quick, it's way beyond my JAQ probably to go visiting folks' departments and do workflow consultations and stuff. But if you just want to chat about, if you just want to hit me up and say, well, I've got this that I do, let's talk about it a little bit. I'm happy to think about maybe how we can break some stuff up into pieces.
Perfect.
That's kind of like what I'm, oh, sorry.
I was just going to say, I will put your contact information in the chat, your email, if that's preferred.
Because I'm kind of here as the Staff Senate Tech Chair, and our Staff Senate Tech Committee is all about helping our senators get better with tech stuff, and we want to help our campus community too.
Awesome.
Because our staff senators, your staff senators are here for you.
That's right. All right. Thank you so much, Daniel. I mean, I learned a lot. My supervisor, he's sitting next to me. He's trying to look into it already.
If you're a supervisor and you're listening, please give your colleagues who are interested in this time to fool around with it and get their hands dirty and get acquainted with it. I think it'll pay off.
Perfect. Just very quickly, I just wanted to touch on, we do have our October Lunch and Learn ready to go. We have a little bit of a description. It will feature Dr. Annie Temple, I apologize in advance, and Vanessa Oliver. They'll be talking about the health at every size framework, which is understanding that health is available to all people of all body shapes and sizes. And it's going to be an introduction to intuitive eating. It's an anti-diet approach to building a better relationship with food in your body. That will be on October 21st from noon to 1. So this is a repeating series, third Friday of every month from 12 p.m. to 1 p.m. So that will be our next presentation. Are there any last minute questions for anyone here? Okay, thank you everyone for attending. Thank you, Melissa and Daniel, for your presentation and your time today.
Thank you.
Thank you, everyone.